Hi everyone, my name is Cassandra. I'm training to be a doula and I feel like it's really important, so I wanted to share it with everybody, and so that's why I'm starting this YouTube channel. I wanted to share with everyone what a doula is, what we do, how everything works as far as being a doula. So first off, I want to start off by saying congratulations on your new baby. That's awesome. And then I want to say a little bit about myself. My name is Cassandra, and I'm 26 years old. I have 4 children, 2 boys, which are the oldest. They're 7 and 5. Then I have 2 little girls. One's 3 and one's 15 months. And I love babies. They're my life. They're my world. I've been married for 8 years, and I've been studying in college since 2010. I originally wanted to be a midwife, but I keep having babies. Yay! So, I'm doing doula training, which I really am enjoying. I've been doing it for about 2 months now, and it's going great. I love it. I've had 2 births, and they were absolutely amazing, and I'm proud to say that my stats are that both women that I went to the hospital with have not used any medication or had an IV, and it was awesome. Both of their labors were really quick. One was 3.5 hours, and one was 2.5 hours. It was amazing. Both women were just troopers. It was great. And they had healthy babies. It was awesome. So let's talk about what a doula is. A doula is a person that is with a woman who is pregnant and they're with that woman during pregnancy, labor, and then postpartum periods to make sure that everything is going good. A doula is not a medical professional, and we do not do anything medical. If you find somebody who's trying to do something medical that is calling themselves a doula, it is not okay. If your midwife is a doula, then that's okay. But you definitely don't want a doula feeling your cervix or trying to examine you. That's not okay. So a doula pretty much is there for informational support, emotional support, physical support, as far as like massaging goes, comforting you. So let's see. Doula is important because they can help you reduce risks in your pregnancy, reduce risks in your labor. They can help you go with an unmedicated birth, but that doesn't mean that if you plan to have an epidural that you can't have a doula. A doula is still very supportive during whatever and however you want your birth. So, yes, our main focus is on the mom because you're the one that's in the most pain, but that doesn't mean that daddy's completely left out, and I feel really strongly about a daddy being a part of the birth and being a part of the whole thing. Like, I'm there to support him just as much as I am to support her. So I feel like it's really important not to leave them out. Whether it be mom that's there with the mom or it be dad that's there with the mom, whoever it is, I'm there to support all of them, which I think is really important. So what a doula does during pregnancy. During pregnancy, if you're anxious, if you're nervous, if you need somebody to go with you to your doctor's appointment, if you want a little bit more information, that's what I am there for. I'm here to say it's okay if somebody throws a wallet at your stomach. Had that happen with my first baby, totally freaked out and went to the hospital and they thought I was crazy. I'm there so that you don't feel crazy when you go to the hospital. And then, really it's just whatever you need during your pregnancy. Do you need help with exercise? Do you need help with figuring out how your partner can massage you to make your back feel better? I'm there emotionally. You're just having a really bad day and you're anxious and you're nervous and you're so done being pregnant, right? We've all been there. So I'm there to say it's okay. You're going to have this baby. You're not going to be pregnant forever. It's just impossible for you to be pregnant forever. So whether you have your birth by yourself at the hospital with a bunch of people, wherever you have your baby, you're going to have that baby regardless of what happens. And so that's what I do during pregnancy is I help you, I support you. I give you whatever you need that I can provide for you that isn't medically an issue. So I'm not going to feel your cervix. I'm not going to strip your membranes or stuff like that. But I'm there to say I'm your best friend and I'm here to help you in any way that I can. So during labor is huge. That's the main thing of what I do. And I love labor. I know that sounds really crazy, but I think my favorite part of all my pregnancies was the labor. I mean, it's awesome. It's like, I'm a badass because I'm able to do this. It's really just inspiring for a woman to be able to find herself through going through all that pain, and to be able to meet your baby for the first time. No matter what baby it is, it's still just awesome. So during labor, I'm there to help your partner, to massage you, to be there for you emotionally, to give you different positions that you can labor in that will make things easier, to remind you to let your body relax so that your cervix opens up, and so that you're not in labor for 24 hours or more. I'm there for him if he's hungry and he doesn't want to leave your side. I can go get him food. I'm there for your mom when she's worried about you and she remembers having you, but she is scared. She doesn't know what all this stuff means, or say your baby's heartbeat drops, or something happens and you're nervous and scared. I'm there to comfort all of you in the room, regardless of who it is. So I'm there to explain medications. There's just so many things that a doula can do to help you, no matter where you are in your birth, no matter what you want to do or how you want to do it. It doesn't matter. I'm there for whatever you choose. It's not for me to be like judgmental and tell you, oh, you shouldn't go with medication, you shouldn't have medication, oh, your baby should have circumcision, your baby shouldn't have a circumcision, so on and so forth. Whatever you choose is what I support you in. Whether you want to breastfeed or you don't want to breastfeed. Whatever those options are, I am there to tell you what those options are. So I don't want people to think that, I think my biggest thing is, I don't want people to think, oh, well, I have a partner so I don't need a doula, or, oh, I'm going to have an epidural so I don't need a doula, or, I mean, there's just so many things that people would think that really isn't true. There are a lot of myths about a doula, and what a doula can do, and what a doula shouldn't do, and what really is a doula, and doulas are for hippies. No, not necessarily. I think anybody could have a doula. So then postpartum periods. A doula is there for postpartum periods, for helping you to breastfeed, bottle feed, whatever you choose, to help ensure that you are healthy and baby is healthy. Again, we're not a medical provider, and we're not there to, do circumcisions or to check up on heartbeats or make sure everything is good like that. That's not what we do. Not saying that most doulas aren't qualified for that, but just saying it's not something we do, and it's not something we should be doing. So I just want everybody to remember that. That's really, really huge. And a doula does not give you medical advice. We're just there to give you information so that you can talk to your care provider and get information that you need. Postpartum periods, I always bring my clients a meal because I feel like that's really important, and I don't charge extra for it. That's just something that I do because I feel like it's really important. Mommies and daddies and babies and families should be spending time with that baby, not worrying about, oh, I gotta make dinner, oh, I gotta clean dishes, I gotta clean the house, whatever. So doulas can do anything postpartum that you feel comfortable with, unless it's medical. I keep going back to that. Anytime I'm talking about anything, it's totally not medical that I'm talking about. So if you want your trash taken out, if you want your dishes cleaned, if you want vacuuming done, if you need grocery shopping done, doulas can do whatever you ask them to do. Now, prices may vary and change depending on that situation, but you just need to keep that in mind. So I think I'm going to end this video for now, and I'm going to come back. I just wanted to get you guys an idea of what a doula is and why I'm doing this channel, and kind of let you get to know me a little bit better. So thank you for watching. I hope you enjoyed my video, and I hope you enjoy many more of my videos. I really love and I'm really compassionate about what I do, and I can't wait to share more with you. I just love the work that I do, and I'm so happy. And it's just great. I just love it. So have a good day. Good luck with your pregnancies. Stay close. And it was nice getting to have my video on here. Bye.